I'm Victor McConvey from Parkinson's Victoria. Today I'd like to talk to you about managing hospitalisation. Probably one of the most important aspects of managing going into hospital is sort of planning to actually go. So some important things that you can do to make things a bit easier are things such as, if you have to go to a pre-admission clinic, take your medication along with you with the times that you need to take it, and talk to the nurse who's in the clinic about, is it possible when you actually get onto the ward that these medications can be delivered at the same time. Inquire about self-administration of medication. That's a procedure where you're actually given control over your own medication, so you would take it very much as you would do at home. When you do take your medication into hospital with you, it's always important to take it in its original containers. In the public system, they won't use your medication. They'll actually get medication supplied through pharmacy. However, in the private sector, they'll very often use your own medication. It's important to take it in its own containers so the doctors can identify the medication and the times that it's been prescribed, so that your drug chart will actually reflect that. Another thing that's often important when you're going into hospital is to take a bit of a diary in. And it's just a bit of an example of a couple of days of what it's like for you living with Parkinson's. When are your good times? When are your off times? Do you experience any difficulties such as hallucinations or have difficulties with sleep and night time? So they're just a few important tips that can help give the nursing staff and the staff that will care for you in the hospital a bit of fabric as to what it's like for you living with Parkinson's disease. One of the biggest problems that people have experienced when they do go into hospital is actually getting their medication on time. Often you need to take Parkinson's medication quite frequently and often at quite unusual times. This usually doesn't reflect the normal times when hospitals would administer medications. And in fact, in a survey that we've done with members of Parkinson's Victoria, they actually identified that getting medication on time when they're in any place of care was probably the biggest difficulty that they actually encountered. We know it's a continuing issue, and we know that our hospitals are increasingly busy places. As I mentioned earlier, illustrating to the nursing staff when you take your medication, it's always worthwhile if you can talk to the nurse who's caring for you and have a check of the drug chart to make sure the drug chart reflects when you take your medications. And just inquire about things that might make it easy for the nursing staff. Things such as maybe you need to take your medication timer into hospital with you, and use that as a prompt. When your medication timer goes off in your pocket, you need to ring your nurse call bell to ask the nurse to administer your medication. Please be understanding that the hospitals are very busy, and sometimes it's not always going to be possible, but it's also very important for you. So if it's not happening on a regular basis, we might need to actually start to talk to the nurse in charge of the ward to look at a way around that particular problem. Often when you go into hospital, or even for a day procedure, you might need to fast for a procedure. For most procedures, you're usually able to take your medication with a sip of water. However, you must check with the doctor and preferably the anaesthetist who's actually going to be at the procedure as to whether this is actually possible. By and large, they'll say it is possible because we actually will need you to be back on with your medication so that you can actually sort of get through a recovery room more quickly. And also it'll make you a bit more comfortable too. If in the event that it's not possible for you to take your medication, probably the first thing that we need to discuss is that you will probably experience more symptoms of your Parkinson's, so you'll probably be a bit more uncomfortable. We need to let the nursing staff caring for you know that you will be a little bit more uncomfortable and possibly a little bit more irritable, but also that you'll need a lot more assistance to actually achieve any activities of daily living because you have a very low level of dopamine on board. Once you've actually done that, we then need to look at ways to reintroduce medications following this procedure, and the best person to actually consult in regards to this is your neurologist. So if you're having a procedure, and it's usually a major procedure where you have to fast and not take medication, we need to involve your neurologist in planning the care. Many people with Parkinson's might actually find themselves coming into hospital sort of as an emergency admission and entering via the emergency department. And as I'm sure if you've been aware of any of the press, our emergency departments are very busy and often quite chaotic places. It is often very difficult to get medication on time in these environments. However, it's always worthwhile flagging, if you possibly can, that you have Parkinson's and you have a need for medication. Ideally, if you're in the emergency department, you'll have a carer or someone who can advocate for you with you. But it's very important to keep telling anyone who comes near you that you need to take medication, and explain to them often that when you don't take your medication, you need a lot more assistance with your Parkinson's. Emergency departments are particularly difficult environments, and all I can sort of say is just you have to keep telling your story to try and get the message through that you need to get medication on time. Often once you've had a hospital admission and it's time to go home, if you're living with Parkinson's, probably you and your carer need to talk to each other and sort of say, are you actually ready to go home? If you've had a fairly difficult admission, it might be that you actually sort of need a little bit of convalescence or rehabilitation after your hospital stay, and that may need to be arranged. If you are feeling that you're right to go home, which would be fantastic, one of the most important things is look at, do you need any additional supports at home? Through the public healthcare system, people who are patients in the public healthcare system are able to access a program called the Post-Acute Care Program, which provides you with up to 4 weeks of support following your discharge from hospital. That support can range from anything from home nursing through to assistance with home care and also personal care. And a variety of different things are actually available. So you should actually inquire, if you're in a public hospital, about access to post-acute care programs, which just makes the process of going home a bit easier. Unfortunately, in the private sector, often the supports following discharge are far more limited, and you would need to talk to your own health fund in regards to that. Often when people have been in hospital, things haven't always gone as smoothly. And one thing I would encourage people to do is, if you're getting the sense that things aren't going very well, if you're getting medication consistently laid over a day or so, and people aren't sort of really seeming to understand your Parkinson's, it's often worthwhile to sort of make your difficulties known to the nurse manager of the ward. Ask to speak to the charge nurse and sort of and outline what the problems you're actually having are, whether it be medications on time or someone who doesn't understand the symptoms of Parkinson's. And we can often rectify these locally before they become a major issue. And the most important thing is, while you're in hospital, we want your stay to be as comfortable as possible. If, however, things are consistently going wrong and you're very uncomfortable, or you don't feel comfortable talking to the charge nurse, most hospitals have a patient liaison officer who you can talk to, and they're an impartial person who can actually sort of advocate on your behalf. There's also external facilities such as the Office of the Health Service Commissioner, who can also advocate for you, and that's usually following a stay where there might have been some more serious issues. One of the things that we would like to encourage people to do is maybe to plan hospitalisation a little bit better. And we know it's often something you can't predict when it's going to happen, but certainly at Parkinson's Victoria, acknowledging that often people with Parkinson's do go into hospital on a sort of a frequent basis. We'd like to plan a bit easier. We also know that some of the difficulties that people encounter. So we've actually developed a hospital kit at Parkinson's Victoria, which contains information for you to help plan going into hospital a bit better, but also information to hand on to the nursing staff that explains quite briefly what Parkinson's is and some of the symptoms that they might encounter with you as the patient. You're actually able to obtain a hospital kit through phoning Parkinson's Victoria on 1800 644 189.